in the sunset. Now your time has come.
5 minutes after 11 o'clock. You just missed probably the best moment of the day. Robin found a false eyelash on the floor. Of course, it could have been a real eyelash. I don't know. Where do eyelashes come from anyway? Do they make them? Is there an eyelash factory somewhere? Okay, that has nothing to do with what we're going to talk about. Well, let me put this picture on here. There you go. Lauren Debick is here from Ocala Health, and Lauren has invited Michelle Hodges to return. Michelle is the Clinical Cardiovascular Service Line Administrator for Ocala Health. Good morning, ladies.
Good morning. Hi, how are you?
I'm good. Everybody got their eyelashes?
We're set. We're good.
Is there an eyelash factory somewhere? I mean, can you imagine working in that place?
No.
Getting your boss boss says to you, you didn't take any, did you? You didn't take a false eyelash home, did you? Can you imagine that? If they were, never mind. So good morning again. Thank you for being here. Clinical cardiovascular. What does that actually mean? The word clinical. When you say clinical, what does that actually mean?
Well, I mean, that's anything involving any of the clinical, the patient care, procedural.
Does that mean outpatient? I mean, does it mean like?
Well, certainly it applies to both outpatient and inpatient.
Okay.
So any of our patients that come in and have procedures or cardiac services, I work with those departments that provide those services in terms of quality, in terms of patient experience, and just making things smooth for the patient.
When somebody has gone through a heart surgery, I'm guessing they don't ever want to have to go through something like that again. So I would think that they would start to change their lifestyles, right?
We certainly hope so, and that's something, patient education is really important. Definitely, if you are prone to cardiac issues and you've had some sort of procedure or surgery, as you mentioned, it really is important that you really try to control those risk factors that you can, smoking, the way you eat, those types of things. So exercise.
The way you eat or what you eat?
What you eat, how much you eat.
I didn't know if chopsticks helped or not.
No.
You ever see the people who use chopsticks, though? They're usually pretty thin. I was starting to think, maybe that's the secret.
I wish it were.
Why?
Be so
Do you eat with
easy.
chopsticks? Oh,
I would eat with chopsticks more. I can use chopsticks.
I've never. Had you eat with chopsticks?
Perfect easy.
Look how good she looks. You see?
Yeah.
Not all the time.
She's got better
Not all the
genetics
time.
than I do.
Oh, you have a fork. Oh my gosh. How do they eat cereal and soup? There's no soup or cereal in chopstick land, huh?
Yeah, how they're doing that.
I don't even want to say what country because I could be wrong. Is it China? Is it China or Japan or both? Who uses chopsticks, Robin? Robin knows.
Oh, Japan.
Oh, Japan. Okay.
Yeah.
I don't know. What do I know?
Okay.
And China, I think. Don't they both?
You would have thought.
Yeah.
I would have thought.
And the Vietnam, too, because we had some people
Right.
staying. The Vietnamese use chopsticks also.
So is that part of what you do? Is to help somebody get on the not the chopsticks part, but get on the right track with their lifestyle choices?
Certainly. I mean, obviously we have staff, and a lot of that falls to our nursing, and obviously physicians do education. But I work with those people to be sure that they know how to properly educate the people. We look at a lot of our the ways that the clinical protocols that we treat patients. So all of that kind of falls under me and myself working with the directors.
And explain the word radial. What does that actually mean?
So radial applies to the radial artery that's actually located in your wrist. And
In your wrist?
In your wrist.
Okay.
So there's an artery that essentially starts in your wrist, and it essentially travels, it branches and enlarges all the way up to your aorta, essentially. It goes from the radial to the brachial to the axillary, and that falls into your subclavian, which ultimately leads to your heart.
Goodness.
Wow.
You know all your body parts.
At least the heart and vasculature.
So arteries are the vessels that bring blood from the heart or to the heart?
They bring blood actually typically away from the heart and going out to your body. The veins carry blood that's already been used back to your heart.
So the radial artery
Right.
goes from your heart to your hand, basically?
Right. It's basically the artery that feeds blood
Oh,
to your hand into your forearm.
Is that why when somebody has a heart attack, your arm hurts?
No, not necessarily.
Oh, okay.
That's
Okay.
not necessarily related to that. But the radial artery is really important because we have found a use over the years to use that as a new method to perform heart catheterizations, so cardiac catheterizations.
Really?
Right, and
You
that's what's
push it
kind
in
of-
through the wrist?
We can. So most people who have had heart caths
Oh
or
my
heard
gosh.
people, they know, hey, you get a stick kind of in your groin area. That's the femoral artery, the big artery that feeds your leg.
Right, right.
And certainly, that's certainly done nowadays with great prevalence. But over the years, there's been research that has shown that there's definite advantages to not using your femoral artery and instead using that radial artery that's in your wrist.
Can you imagine the first doctor that suggested that?
Yes, actually, many, many years ago, he actually fed it in, and then he ran upstairs and took an x-ray so he could prove that he fed that catheter in from his wrist to the heart.
Oh, from his wrist. Okay. Well, who did it from the groin first? That guy must have got some pushback.
Yeah,
huh?
I can imagine.
We have to put something in your heart.
I know.
What are you
I
doing
know,
down there?
Yep. It's amazing
But
how
you're asleep
the
when they do
vessels
that,
are-
right? Are you
Yes.
asleep?
Yeah. You're not fully asleep. We use what we call conscious sedation. So you're really sleepy. You could still answer a question if we talk
That's
to you.
me at 2 o'clock.
But you're not going to feel any pain. Right.
Conscious sedation. I got a word for it now.
Right.
So when you hear about people slitting their wrists, that artery is very close to the surface. So when they slit it and the heart is
Right.
pumping, that's why
Right,
they
you
would
can bleed
die
out
so
of it.
suddenly.
Right,
Let me just
exactly.
think of that.
Exactly, because the arteries are kind of our high pressure system. So absolutely, if you cut an artery, then you could certainly bleed to death very easily.
So is this the new way of putting stents in?
It's not new per se. It was first done in Canada actually in the 80s, the late 80s.
Really?
But it's newer in the States. And I say newer, I'm talking from like the mid 90s. But it's something that when cardiologists do their cardiology fellowships, so their advanced training, it's something that typically cardiologists weren't being routinely trained in. They were always trained in that femoral access going through your leg. But now that, like I said, there's so much research and it's so much nicer for the patient. So now
Wow.
it's become more commonplace in those fellowship programs to teach both. They still are always going to teach
So
the femoral.
I have a question about doing it. I mean, pushing it in there. I mean, how does, what, is it on a wire or something?
So the way it works, there are catheters, and yes, there are wires. So what we do is the physician first makes a little needle stick into the wrist and accesses that artery.
Okay.
And then what happens is they actually feed a wire, which is flexible.
Right,
It
I
can
hope.
have some stiffness, but it's flexible, and they will feed it up to the point where they're trying to get to. Which
And
is
do they
essentially-
look at it somehow, like with a?
Yes, so they can see it under, like what we call fluoroscopy, so under the x-ray when you're in
Okay.
the cath lab.
Right.
They're able to see that wire being fed up.
Oh, I hope I never have to go through this.
Yeah, it's actually, you'd be fine.
No, I don't want to do
You
it.
would be fine. I would do it. It would
What?
be fine. I would do it.
You would do it.
I would do it.
This
It's
is
not bad.
this is on an outpatient basis.
So we do outpatient and inpatients.
And then how do you take care of yourself on the outpatient side after it's all done? You've got to be really careful.
Yes, but actually less careful than when we access your groin.
Yeah, I bet.
So really, just as far as just the procedure itself, so we do feed that wire, and then we actually put a catheter. We can feed it over the wire, and the catheter too has different shapes, different bends, different angles on the ends. Because it has to, be able to go around curves, and in order for the physician to get that catheter right into the coronary arteries,
Wow.
having these specialized catheters help. So that's fed over that wire
So
up
do you-
there, and then the wire's taken out.
So the heart is pumping blood the opposite direction that it's going.
Exactly. So right.
So it
exactly.
doesn't
It's kind
push
of
it
pumping,
away,
It's kind of
or
pumping against.
does it-
No, and
no?
that's where a little bit of that stiffness, the wire. They do make wires a little bit stiffer, so that wire
They can
helps
fight it.
helps
Oh my
guide it up there.
gosh.
Then they put the catheter over the wire.
If people have this done, can they donate blood? I mean, can they still donate blood?
Yes, absolutely. So yeah, there's actually two arteries that feed your hand and your forearm, the radial and the ulna. And one of the things that we do for someone that we're considering to do a radial approach is we do what's called an Allen's test. It's just a quick, simple test. We do it before the procedure. It just tests the health of both the radial and ulnar. So in case we were to have a complication and lose the radial artery, would that ulnar be able to still perfuse the hand? And so we do that, and certainly unless if it's abnormal,
You
then
could
we
lose
would not.
the artery?
It's a very rare complication with any catheter.
What lose mean? It doesn't work or it's gone?
Right. It could. Obviously,
Collapse?
there's always a chance.
And then
it
what
could, it could
happens?
tear,
You die? Your hand
potentially
falls
tear.
off? What happens?
Well, So it potentially could tear, but so could the femoral. Actually, there's less potential in your radial artery. But what would happen is because we do that Allen's test, we know that the other artery would be able to take over that blood flow. And that's the point of doing that test before you proceed radial. So
It's amazing what you can do. And prior to being able to do it that way, you actually had to open up the chest.
No,
No,
So
never?
these are heart catheterizations. So these are where we put a catheter up into your heart to look for blockages. So we can do that picture to look if you have a blockage, and then that's called a diagnostic cath. And then if we see that you have a blockage, then hopefully we can go in and put a balloon in, do a balloon angioplasty or a stent. So that's
Wow.
what we do in the cath lab. You have open heart surgery sometimes for some blockages that aren't good candidates for maybe a stent or balloon.
Okay.
So
And do you also insert the stent that way too?
we can,
in the balloon?
absolutely, right. So what we do at Ocala Health is, we certainly still use femoral access, but now we're, more than half of our interventions, the balloons or the stents are performed by radial access. So
Do you have angels like hanging out? I would imagine just the fact that you do all this stuff for people.
Healthcare is amazing.
They must be
It
coming and
really
going
is.
all the time.
Well, especially obviously, we're in Marion County. Our county and surrounding areas, we have a largely geriatric population, and heart disease
Yeah.
is, very much a geriatric. Certainly, there's people younger in their lives as well, but certainly do see more older people affected. So there's a huge need, and so what we do is we want to, keep up with technology. We want to look for new ways to make it better for the patients. One of the nice things about radial access, really the benefits are there's a decreased chance in bleeding because for one, the artery's a little smaller than if you think about your leg artery.
You would think, yeah.
The other thing is because it is closer, if you do have a little bleed, you're able to see it much quicker because you're so close to the surface. Where if you're
I see,
puncturing
right.
deep into the leg, you
Oh
may
my
not necessarily
gosh.
know you're bleeding on the inside until you've already had some significant bleeding. So biggest benefits are reduction in bleeding risk and really patient comfort. Because when we access through your femoral artery, your
Yeah.
leg,
It's embarrassing. It's got to be.
no, we
No?
keep you very covered.
Yeah, I know, but just,
We would take great care of you.
I had a vein thing. They did a vein. Yeah, they did a vein
A
thing.
venous ablation, maybe.
Yes, they did that. And, they were touching that thing. There was a cloth over it, but,
Right.
oh, man. All right. Sorry. Lauren, congratulations. You graduated. I saw you on Facebook.
I did. Thank you.
That's so nice.
Congratulations.
Thank
Did you have to go to Colorado for the diploma?
No, they mailed it ahead
mailed
of
it?
time,
Wait,
but
but
I did go for the graduation
Oh,
ceremony.
you did? I thought I saw, yeah. You
Yeah,
had
I was in Colorado last
Well,
week.
that was nice.
Congratulations.
Thank you.
Congratulations.
So you actually studied in Colorado?
It was online.
On
It was
co-
through the University of Denver.
Wow. Well, good for you.
Thank you.
We're not going to lose you now, are we?
No,
You got a
no.
diploma? Okay. All right. I saw that.
can't go.
It's an
Yeah.
amazing. Yeah, I know. All right, we take a little break. Sorry, and we'll. Go ahead. I'll
No,
just
no, you
take
go
the.
ahead.
I'll put the break.
So when the people that want to major in this field and they come to you, how do you help them get over their nervousness that they're not going to do something wrong and harm the patient when they're just beginning on?
Oh, for learning radial access.
Yes.
Well, so there is a learning curve. They say, for an experienced interventionalist or cardiologist who does diagnostic procedures, in their fellowship program, they have many, many opportunities to perform these procedures. And so they say really for the radial access, because it is a little bit different, probably about 50 procedures to become proficient. So it is a learning curve. And it's one of those things, a lot of times they will learn first on models. There's training courses that
models.
physicians can go, not models, replicas. Maybe that's a better
Did you
way to
say
say
models?
it.
What did I hear?
So no, there's actually courses that physicians can go to, and first they practice not on a live patient, but they can learn the access technique.
Oh, they're dead? You have like catheter? What do you call them?
Cadavers.
Cadavers?
Those are some opportunities as well, and those are typically training courses that physicians can go
Oh
to.
my
But
gosh.
but like I said, after usually by 50 procedures, a physician who's already been doing femoral access is pretty comfortable. So
That's a pretty necklace, by the way.
thank you, and you're not going to believe who gave this to me. Miss Lauren.
Lauren.
Oh, I did.
My secret
She
Santa
forgot.
at work.
How long ago? You forgot? Must have been a while
Christmas
ago.
time.
Oh,
We do a
Christmas
Secret
time.
Santa, and she happened to be my Secret Santa.
Wow, you did a
So,
good
yeah,
job.
she's got
That's
great
good on you.
taste.
You picked out a pretty necklace.
so thank you.
Very nice. All right, now we'll take a little break, and we will be right back. And if you have a question, by the way, we invite you to call. But when we come back, Lauren will give you another number to call for all of your. A lot of times, it's awkward for people calling the radio show. They got something serious, it's a medical issue, and it's awkward. So we do have a different number, a more private number. But if you want to call on the air, we'll all learn from it. We'll take a little break and be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. For the rest of the day, sun and clouds giving way to a shower or heavy thunderstorm with an afternoon high 84 to 88. A shower or thunderstorm in a few spots early this evening. Otherwise, turning out to be partly cloudy tonight with a low 70 to 72. From the Florida Weather Center, I'm Kevin Snyder.
Pay your taxes, eat your vegetables, watch your weight, mow the lawn, clean the house. We all have stuff we don't want to do. Isn't it about time you did something you wanted to do? Like getting your pilot's license?
At Ocala Aviation, they make it fun and easy, and you can start by taking one of their Discovery flights. For only $99, you get to go up in the airplane with an FAA-certified flight instructor and actually fly the plane yourself. It's a perfect way to see if flying is for you. And once you get that ultimate feeling of freedom, Ocala Aviation can train you to get your pilot's license. Ocala Aviation also offers commercial flight training for those looking to make a career change and enter the world of commercial aviation. Ocala Aviation is conveniently located at the Ocala International Airport. So if you're ready to start your adventure, stop by or give them a call today. 861-7484. That's 861-7484. You'll be glad you did. I know I am. Ocala Aviation.
Call today, 861-7484.
The Coke Zero 400. It's where valor meets velocity. It's where celebration meets acceleration. All-American meets absolutely amazing. At the Coke Zero 400, powered by Coca-Cola, Saturday, July 1st. Kids 12 and under are just $20, including free UNOH fan zone admission. Guarantee your seats at 1-800-PIT-SHOP or DaytonaInternationalSpeedway.com.
What do I do now? After 911, don't worry, call Fakuri. Fakuri Medical and Chiropractic, treating auto injuries for over 32 years. Same-day appointments, immediate medical attention, all under one roof. Don't worry, call Fakuri. Go to bestinjurycare.com. All auto insurances are accepted. Available 24 hours a day, 7 days a week to take your call. Car accident? Don't worry, call Fakuri. bestinjurycare.com.
All right, 23 minutes after 11 o'clock. Again, the phone lines are open if you'd like to call. We're talking about the radial approach to putting a stent in your arteries and near your heart. Am I doing it right? Am I doing a good job?
Right.
Michelle Hodges is here with Lauren Debick, both from Ocala Health, talking about the procedure. If you have any questions about it, call. But if you don't want to call on the air, we understand. And Lauren has a different number for you to call, right? What is
Correct.
What is
And
the number?
it's 1-800-530-1188.
And that's good for pretty much every medical question, right?
Correct. Physician referrals, medical questions. We have RNs on staff 24/7, so you can call at any time, and they will be there to answer your questions.
Yes, yes. And that is the number that Robin called when she had her Bell's palsy.
Yes.
Right? And that is the number I called when I had my vein thing happening in my leg. And you guys helped out both of us. All right, so the question, Robin had a question off the air regarding recovery time. Is there something? Well, tell me about the recovery time and the recovery process, I guess.
Sure. So really with radial access, the recovery process is so much easier for the patient. Those people that have had a prior cardiac catheterization where we've used, the normal approach, through your femoral, through your leg, remember probably vividly when they came back from the cath lab, they were comfortable during the procedure, but then we tell them, hey, you're going to have to lay flat on your back for a couple of hours. We're going to hold some firm pressure on your leg. And for a lot of patients, that laying on the back, especially elderly population, they have back problems, arthritis, that 2 hours or so of just being flat on your back. You're not able to go up, get up and use the restroom and whatnot. So that's usually the worst part of the procedure for patients. It's just that recovery.
What is happening during those 2 hours, though? I mean, is something clotting up or healing?
Right.
Okay.
Right. So the artery that we access in your leg for that approach, the femoral, is a big artery, and it's obviously very deep. So we have to make sure before the patient, sits up and starts walking that there's a good
It
blood
doesn't
clot.
pop open.
Exactly.
Yeah.
Then you could certainly bleed.
Oh my gosh.
So it's really important.
Yeah.
We hold pressure usually for about 30 to 45 minutes at the bedside, very firm pressure on your leg to initially kind of stop that bleeding. And then from there, the patient's going to have to lie flat and keep their legs straight for another, usually a couple hours before we know that it's safe for that patient
How do you
to
know?
start.
How do you know that it's...
Well, we check. We check the groin every few minutes, and we look for any certain signs of bleeding and that type of thing. So anyway, so that's usually the worst part of the procedure for the patient, not the actual procedure itself. Just that
Okay,
being
right. That's
uncomfortable.
So
So that all is really avoided when you use radial access, because that wrist artery is so close to the surface. We're able to really see it well. We have a little, I guess, almost like a bracelet, for lack of a better word. It's a closure device that actually, when we take out the catheter, we put a little bracelet on them, and then we inflate a little balloon, and it actually holds pressure. We can see it. It's clear.
Oh, wow.
And the nice thing is the patient doesn't have to lie flat. They can sit up. We can feed them lunch right then because they're fasting. If they need to go to the restroom, they're able to get out of that bed and walk over. So it
that's a
really
big
makes it.
improvement.
It
Yeah,
is.
yeah.
It really is. So patients, that have had a femoral cath prior and then have an opportunity to have a radial, typically they say, I would love to have the radial again, just for those reasons.
I would love to have it again.
If I have to have it again.
If I have to have
Right.
it. Yeah. That's when you start eating cabbage all day long.
Right.
So the patients have to fast a day before the procedure?
So typically, we tell them no food after midnight. We do like them well hydrated, so we want them to drink, up until the procedure, but not caffeine. But we do want
No
them
caffeine.
well hydrated, yeah.
What does caffeine do for you?
It's just a stimulant, so we just like to have them
Okay.
non-caffeinated.
It doesn't do anything for me. I drink coffee. It doesn't wake me up. Yeah. If I'm sleepy, I'm sleepy.
Yeah.
Right?
So.
But I guess it's a stimulant. So somebody who gets this, do they ask for it, or is this the normal procedure now?
So we have several physicians that perform these types of services, cath services at Ocala Health, and really it's partially physician preference. Some physicians are largely radial. Others still prefer the femoral access for their patients. So the physician certainly has some bearing on
Okay,
that.
okay.
And also the patient. There are some patients that are definite candidates where you really want to consider that. Someone who may be very obese would be a great candidate, especially for radial access. Someone who we know has vascular disease already in that leg artery, then it's much better to
okay,
use.
okay.
So there are some patients where you say, hey, this would really be a better approach. But usually that dialogue is between the physician and the patient.
Now, when you do this procedure, does that determine whether it is a stent or a balloon that goes in? Can some people use stents and not balloons, and vice versa?
Yes, absolutely. So anytime a physician does a diagnostic cath and they determine if there's a blockage, at that point, depending on the location of the blockage, maybe the severity, some blockages may not be at a point that they even should be fixed yet, minor blockages. But if it's a blockage, assuming it's a blockage that would meet the criteria that they really should have some sort of an intervention, then yes, some patients would be candidates just for a balloon angioplasty, where we inflate a balloon and then we take the balloon out. I would say more patients probably have a stent placed. We use a lot of drug-eluting stents nowadays.
What is that?
So it's kind of almost like would be similar to if you have a pen and you take off you take apart your pen, you see that
Right.
little coils, that spring thing.
Right.
You can kind of liken that to a stent. So a stent actually stays on the catheter, is deployed through the catheter.
Wow.
And what they do is it goes up into that area of blockage, and then actually we put a balloon inside the stent, we inflate the balloon, and then it
amazing.
expands that stent. But the difference between the balloon and the stent is the balloons we take out, so nothing stays with you.
Gotcha,
The stent
gotcha.
actually stays in there, and actually your own body will just kind of endothelialize over it, but it'll help keep that artery open. So
Wow.
it doesn't,
Oh, my God.
It's amazing what
close.
you do, Michelle.
You're
And we can do both of those through the radial access as well.
Michelle Hodges, thank
You're
you so much.
angels.
Lauren Debick, thank you so much.
Thank you.
Phone number one more time?
1-800-530-1188.
Thank you.
Thank you.
We'll be right back.
Fox News Radio. I'm Lillian Wu. They're calling it a bittersweet return. The family of the American student released by North Korea speaking out. Otto Warmbier's father, Fred, saying he doesn't believe North Korea's explanation. His son is in a coma because of botulism and a sleeping pill.
I'm so proud of Otto, my son, who has been in a pariah regime